Hi, my name is Stephanie Porter. I am a certified athletic trainer licensed in the state of Ohio. I am currently working at Delphus Jefferson High School. This is my second year here. And today I'm just going to talk to you a little bit about what it takes to become an athletic trainer, what all it involves, and what all the fun things you get to do as an athletic trainer. I graduated from Fostoria High School and I did my undergraduate degree at Baldwin Wallace University in Cleveland. In order to become an athletic trainer, after your first year for your bachelor's degree, so your first out of your 4 years, you apply for the athletic training program. And from that point, you will either be denied or accepted into the athletic training program. Once you're accepted into the program, you'll start taking more specific courses as far as sciences, more directed towards athletic training. The entry-level ones, before you get accepted, you're going to have to take an anatomy and physiology, and you're going to have to score a certain grade in order to be accepted. Usually it's about a C average will get you accepted into the program. From there, once you're accepted, you have to do clinical hours, which will be more hands-on work with different athletic teams and programs at the school wherever you go. From there, you actually work with certified athletic trainers for the school that you're attending. They help you get some experience, see some different things that you normally wouldn't by just sitting in the classroom. So it gives you the opportunity to apply the knowledge that you're learning in the classroom on the field, so it's more hands-on. I actually got interested in athletic training because I was in athletics growing up through my whole life, and from there I experienced some different injuries, and I worked a lot with athletic trainers and physical therapists to get myself back onto the field or court, whatever season it was, and I realized what an impact they had on me. And from there, I kind of just grew my interest. So after you finish your degree from your 4-year college and get your undergraduate in athletic training, what you're going to have to do is you're going to have to take a board of certification exam. That's just a national exam to make sure that you are qualified to be an athletic trainer. It's stressful, you have to work really hard, but all of your 4 years really leads up to it, and you'll be prepared for it as long as you've taken your classes seriously and all the experience that you've gained. And then once you pass your BOC exam, what you can do is you can apply for state licensure. So I applied for the Ohio state licensure because I wanted to practice athletic training in Ohio. If you wanted to go to a different state, you can just apply for a different state licensure. There's just different requirements for the specific state. So if you plan to go somewhere else, it's important to look at those state requirements. After you do that and you are approved for your state licensure, you are eligible to start practicing and start working as a certified athletic trainer. And as an athletic trainer, there are many different fields that you can go into. I am currently in the secondary school setting, which is just the high school setting as an athletic trainer, but there's different routes that you can take. There are athletic trainers that practice in the college setting. They go to all the different college, sporting events. There are athletic trainers that work for the professional sporting teams like the NFL, the MLB. The NHL even has, certified athletic trainers that work with their teams. And then another route that you can take, there are marketing opportunities with athletic training. There are companies that go around and sell athletic bracing, different rehab tools, and most of them are athletic trainers or have an athletic training background. So there are different routes that you can take as an athletic trainer. You don't just have to work at a high school. A typical day for an athletic trainer, it's usually mostly a second shift job, especially in a high school setting. You're going to come in typically around when school is letting out, get ready for the practices, tape the athletes, get them ready, stretch them, make sure they're prepared to go out for their athletic event, whatever that may be, depending on the season. As athletic trainers, our main purpose is to evaluate, treat, and then rehabilitate athletes. So my typical day, I come into the school around 3 o'clock, right when school is getting out. I will see any athletes from the night before who may have been injured and I haven't seen yet that need to be evaluated, take care of any of that. Then I typically have my set rehabs where I will work with athletes who are currently dealing with an injury and, stretch them, do certain exercises, and get them ready to get back on the field, hopefully sooner rather than later. And then from there, I'll head out to the different practices. I'll walk around, and right now I've got baseball, softball, and track. So, I'll hit the softball field and check on them. Then I'll go to the baseball field, and then I'll head to the track just to make sure that everyone's doing okay and make sure I haven't missed anything. It's really important to have good communication with your coaches and with your school administration just so you know what's going on at all times. The coaches all have my phone number. That way they can get a hold of me. Typically I'll put signs on my door if I'm going to be out, that way they know where I'm at. and they know where to come find me. Another important thing as an athletic trainer is that you have to have, proper facilities and proper equipment. One of the main things that, I always have on hand are gloves and gauze just in case there's, any cuts or abrasions that need cleaned up. An AED is important to have. Most schools have them, but it's important to know where they are, if you were to ever need them. As an athletic trainer, you have to stay up to date on your CPR, first aid, and AED competencies just to make sure that if a traumatic incident were to happen, you're prepared for that. Luckily, I haven't had anything like that happen here. If an athlete comes to me and they're injured, I will typically fill out an evaluation form just to show the different tests in my evaluation process, what I talked to them about, what their history was, how they got injured, if they've seen somebody before for it, if they've gone to a doctor. Another big part of athletic training is communicating with the doctors, especially if it's an injury that will need physician assistance. So if they need to see a doctor and get a cast, or if they have to have surgery for any reason, it's important to communicate those things and tell the doctor what you've been doing. That way they know where to start. It's also important to have good communication with the doctors. That way they know that they can trust to send those athletes back to you and that they're going to be in good hands, and you're not going to do anything to hurt them and you're only going to help them. So impact testing is used as a baseline concussion test. That way we can go back and look at the results. It just tests your memory, like reaction time, recollection, different things, speed, reaction time. And then we can go back and we can look at those numbers after somebody has received a concussion, and we can make sure that they are not only physically but mentally prepared to go back on the field as well, and make sure that their brain is functioning properly and we're not putting them at more harm. Sometimes concussions go unnoticed just because the symptoms aren't always as obvious as, a broken bone or a torn muscle. Most of the time they can still participate, they're just not feeling well. So with the new research, there's a huge push to make sure that we're focused on concussions and getting the athletes the proper care that they need in the rest time to make sure they're healthy, not only in high school, but in their years after high school as well. Another thing, documentation is huge with athletic training. As with any medical field, it's important to document. That way you have something to go back on to prove that you were doing your job as an athletic trainer, and that you weren't negligent, that you are doing what is best for the athlete at all times. We want to make sure that every athlete gets treated the same way. Regardless of sport, regardless of gender, regardless of race, everyone is treating the same way. They're all receiving the best possible care for our athletic trainers. I currently work for St. Rita's Hospital, and we focus a lot on the best patient care that we can provide, and that's the same for all medical practices, especially athletic trainers. We're often the first line for these athletes. They see us more than they typically will see their family doctor or anybody else. We see them at their worst at practices, when they're tired or they're exhausted after a long day of school. And it's just important to pay attention to those athletes, the small things that may go unnoticed if there wasn't an athletic trainer present at the school. If you're interested in athletic training, or think you might be interested in athletic training due to your interest in athletics or the human body, anatomy, and physiology, it would be huge if you started focusing more on those science classes. So start focusing on the health classes, the anatomy and physiology. Spend more time learning your own body and how it functions and different things that you can do. Techniques is that. As far as education goes, there is going to be a change in the next few years, switching from a bachelor's degree to a master's degree. So if you're currently in high school looking into going into athletic training, it's important to look at the different school programs and make sure that you're going to an accredited school that you will be qualified to take your VOC for after you go through your 4 years of school. In the next few years, they will be switching it to a master's degree, so it's important to make sure that you're going to a school that will have that, who's not going to drop the athletic training program. If you're interested in athletic training and maybe filtering that into like a physical therapy degree, it's important to look at those things as well. A lot of people do that, or they go into strength and conditioning. There are ways to do dual accreditation where you can, dual major in those. So that's something to look forward to. Entering college, because then it just saves you some work in the end. If you can double up on some classes, maybe classes overlap, it'll help save you some time. And if you're more focused when you first enter college, it'll go a lot quicker and you won't waste as much time, and therefore money, on classes that you may not need to have taken. even if you do get an athletic training degree, you can even go on to graduate school for physical therapy, chiropractic, occupational therapy. There's a lot of different graduate programs that you can go into with an athletic training bachelor's degree, and many physical therapists actually keep their athletic training credentials. So, that's something to consider as well, that there's many options that you can go to. And then speaking of the continuing education with athletic training, there is a continuing education requirement. So every 2 years you have to supply the national board with proof that you've continued your education. So athletic trainers currently are required to submit 50 continuing education credits. So throughout the course of 2 years, I have to attend courses, do online webinars and different things, taking quizzes just to prove that I'm staying up to date on the current research. 50 sounds like a lot, but over a 2-year period, it's not too bad. And you can go to, they have different courses all over that sometimes last a day, they can last 2 hours, and you can get multiple credits at once. It's just important that you stay up to that, because if you don't, then you have to reapply for your licensure and your certification as an athletic trainer. So some things with technology that have definitely changed athletic training in the realm of athletic training, a lot of it goes into the concussion testing. The impact test that we use is web-based online, so it's just a sit-down computer test. You just take it takes about 30 minutes, and then you're done. But there are new routes that are coming up where they actually use an iPad that you can attach to the waist. It focuses on balance. It gets a better idea. It actually attaches to the athlete, so then tells you different scores upon their balance and their stability, which we can't get with an impact test because they're sitting at a computer. And also with technology, we're finding more proof of concussions just on MRI and imaging, and CAT scans that are showing signs of brain damage later in life after these pro football players. All of this is changing the realm of athletic training. It's changing all of our evidence, how long it takes for us to return an athlete to play. There have been changes in, tape even in the last few years. There are so many different types of tape out. There's the kinesio tape, there's rock tape. There's so many different tapes available that provide different structure and support and stability for, muscular deficits or stability if you've sprained your ankle. So it's important just to stay up on that. Like I said, with continuing education, there are courses based solely on kinesio tape. There's courses on concussions. That way you can focus your knowledge and pay a little bit more attention to it. As far as knee braces and shoulder braces and elbow braces post-surgery, they've gotten a lot sleeker. They're not as bulky anymore. Athletes can participate with ACL braces that typically used to be big and bulky and cause more harm than good to the other athletes if you were playing with them. Now, most of the time, people don't even know that they're wearing them. They go under clothes and you wouldn't know a difference. Things like that are definitely changing the way of athletics. There's more technology now and more research based on how to rehabilitate an athlete, the number of reps and sets, and that goes more into like a strength and conditioning background. But as athletic trainers, it's important for us just to have a base knowledge of that. And you will go through those courses in your undergraduate programs for your bachelor's degree in athletic training. So what I enjoy most about athletic training is I get to just come out and hang out with the high schoolers all the time. I get to do what I love. I get to sit and watch sports. I'm here if anyone gets hurt. I know how important it is for athletes to return to their sport. As sports being such an important part of my life, I know that it takes a toll when you're having to sit on the sidelines and you're not able to do what you love. It affects you physically, but also mentally. It kind of shuts you down. You wish you were out there with your friends. You wish you were, being a part of the team. So that's one thing I always encourage my injured athletes, continue going to practices, continue showing up for your team, cheering them on, and just kind of keeps you a part of it mentally, even though you can't participate physically. I think that's huge. I enjoy seeing my athletes succeed, after coming off of a tough injury or a surgery that takes a long time to rehabilitate. I get huge, satisfaction and happiness seeing them return to their sport and get back where they want to be and continue pushing themselves, and strive for greatness when they don't give up and they keep going and they're able to reach those goals that they had right after they got injured. Typically I have my athletes set at least 3 goals after an injury. I don't typically timeline them because I don't want them to be upset if they don't hit it at that certain time, but they're there and they know that they're constantly striving for that, and once they reach those, there's no better feeling than that.